Good morning, everyone. Welcome, and thank you for joining us for our fourth day of Action Online. My name is Crystal, and I'm the Public Policy and Advocacy Director at NAMI, Wisconsin. And this is my fourth year co-hosting what we formerly called Action on the Square. And now that we've gone viral, we're calling it Action Online. So this portion of our event, we're going to do a deep dive into current legislative issues, and then we'll let you know how to contact your legislators and what to ask them. So let's begin. The one thing obviously on everyone's mind right now is COVID-19. And though it's a global pandemic that affects everyone, it's especially had an impact on people with mental illness who are experiencing increased isolation, anxiety, depression. And with each of these slides, I really want you to think about what ways do these relate to your own life or the life of your loved one. So here are some things that could help during this time of uncertainty. Eliminating barriers to telehealth by ensuring that Medicaid and commercial health plans cover telehealth services just like they would cover in-person services, and that we have technology in place to address growing mental health needs. The one silver lining that's come out of all this is that we've had to be really creative and very innovative in how we're taking care of our mental health. And this is one thing that we want to see stick around even long after this pandemic is gone. We are also interested in creating a work group of stakeholders to explore a model for a 24/7 statewide warm line. A warm line is a number that you can call and get peer support, referrals, resources. If you just need to talk to someone, we realize more than ever right now, we need connectedness. We still need to be able to have some human interaction when we can't do that necessarily face to face. And so a warm line is kind of a step down from a crisis line. It's just a place that you can call and get the support that you need if you're having a bad day, or if your family member is maybe experiencing some mental health challenges. So what I want you to think about is, what barriers have you or your family member had getting help for a mental illness during the pandemic, and what helped or what could have helped? Our next issue we're going to talk about today is access to treatment. And access to treatment is important because everyone deserves access to quality mental health services in their own community. The state of Wisconsin elected a new governor at the beginning of this year, and his most central priority was the expansion of Badger Care, Wisconsin's Medicaid program, to include people who make up to 138% of the federal poverty level. That didn't make it through the legislature this time around, but NAMI members continue to prioritize it, especially now. When Governor Walker was in office, we did what's called a partial expansion, which currently covers people who make up to 100% of the federal poverty level. Governor Evers' expansion called for covering individuals at 138%. So if these numbers aren't making much sense in your mind, that's okay. Essentially, someone who makes 138% of the federal poverty level, an individual makes about $17,000 a year, and a family of four makes a little over $35,000. So if that puts it into a better perspective for you. So we know that this expansion would cover thousands more people. And Badger Care is the largest funder of mental health services in Wisconsin, and it offers a diversity of programs that are not under marketplace plans, such as individualized placement and support, which is a supported employment program that helps people find jobs and keep jobs. It also covers comprehensive community services, community support program, and peer specialist services, which are all really essential to folks who are working through their recovery. So by taking these federal dollars, Wisconsin would be able to save millions of dollars that can then be funneled back into essential community-based programs. Here in Wisconsin and nationwide, actually, we face a significant shortage of qualified mental health professionals, including psychiatrists and child and adolescent psychiatrists. And one of the most significant factors driving this is that many of these professionals are nearing retirement, and we're just not replacing them fast enough to meet current needs. Other contributing factors include geographic disparities. Some of our northern counties share one psychiatrist across 3 counties. There's low pay compared with other medical professions. Isolation, burnout, student loan debt, and lack of diversity in the workplace are other contributing factors to this issue. So this is an issue that we need the legislature to take a really comprehensive look into it. We cannot boost the entire workforce with one bill, one stroke of a pen. So we really need a package of initiatives and everyone to work together on this. So the question to ask yourself here is, what barriers have you or your family members faced accessing mental health services in your community, and what helped or could have helped? Our next issue is suicide prevention, and this is an issue not a lot of people want to talk about. It's very taboo, and even when we're facing a public health crisis and losing lives in Wisconsin every day. Mental health advocates are charged with debunking myths about suicide, such as the notion that talking about it will lead to more suicides, or that suicide is a selfish act. A good place to start is just simply talking about it and how we're talking about it. NAMI Wisconsin was pleased that Speaker Robin Voss recently formed an Assembly Task Force on Suicide Prevention, which was made up of members of the Assembly from both parties. And they traveled around the state holding public hearings and were especially focused on high-risk groups such as youth, law enforcement, farmers, and veterans. From there, they came up with a package of legislation that for the most part passed with bipartisan support, but it was just the tip of the iceberg, and we need to keep that conversation going. One thing that was left out of that package that we really want to push for is an extreme risk protection order. Sometimes you might hear it being called red flag legislation or lethal violence protection order. Regardless of the name, this legislation, which has been passed in several other states and has been shown to save lives, would allow a family member to petition a court to have a firearm temporarily removed from a home where an individual posed a threat of violence to themselves or others. So oftentimes family members see warning signs and there's really nothing that they can do or that law enforcement can do. And we also know firearms are the most lethal means of suicide. And another myth is that an individual will just find another way if you remove that firearm. In reality, the truth is that you've interrupted their plan, and now they might not have plan B. And now we've got some time on our hands to do some intervention, find them some help, and ultimately save their life. So the thought to ponder here is, how have you or your family member been impacted by suicide, and what measures could help save families? One thing NAMI's been so excited about is that we've been a part of a collaboration between the VA and SAMHSA called the Governor's Challenge to Prevent Suicide among service members, veterans, and their families. And we've been working really hard on putting together some asks to present to the governor's office on how we can stop veterans suicide. And IRPO was up there as one of those priority areas, along with peer supports and prevention measures. So when you see that come around, please ask that your legislators support that. We know that jails and prisons hold disproportionate numbers of people with mental illness, and we need to find a better way. People with mental health conditions need access to treatment, and our criminal justice system should not be the gateway to get there. We have some wonderful CIT, crisis intervention team, trained officers that we partner with, and we're grateful for that collaboration. One thing that NAMI Wisconsin really supports is a program called TAD, which stands for Treatment Alternatives and Diversion. And this allows nonviolent offenders to be diverted from jail to appropriate behavioral health services and supports under supervision of the courts. So we have a lot to do in this area. We also know that with COVID-19, jails and prisons are really needing a lot of different things that we have on the outside, from personal hygiene products, medical care. They need to be able to stay in touch with their families. through no-cost phone calls so they have that connectedness, and then 30-day medication prescriptions upon release. So these are really some ways that you can be a voice for folks who are in our jail and prison system right now. So the question to ponder here is, if you or a loved one have been incarcerated, how has this experience affected you or their mental health recovery? And what can we do differently? All right, so our next issue is youth mental health. And the talking point here is youth need access to appropriate school and community-based mental health services and peer supports during the first signs of mental, emotional, behavioral challenges. And some ways that we can help in this area is to support the expansion of the Child Psychiatry Consultation Program. And this is a program that allows primary care providers who maybe don't have a child or adolescent psychiatrist in their area to talk with them and to get support and education in these underserved areas. So we are very supportive of that, and that's another area of kind of telehealth that's really been helping at this time. The next thing we want to ask for is ensuring that there's adequate access to school-based mental health services and peer supports for all Wisconsin who needs it. So I'm speaking to the youth right now. If you are a young person or know a young person who struggled with mental health issues, what helped or what could have helped? All right, so let's just briefly review here. What we're asking is to eliminate barriers to telehealth and ensure it's covered by health insurance. Convene a stakeholder group to explore a 24/7 statewide warm line model. Expand Medicaid to 138% of the federal poverty level. Develop a package of initiatives that will increase our behavioral health workforce, such as tax incentives, employment opportunities, and loan forgiveness. Pass the Extreme Risk Protection Order. Support initiatives developed by SAMHSA's Governor's Challenge for veterans. Increase access in jails and prisons to medical care, hygiene products, no-cost phone calls, and 30-day med prescriptions upon release. Support expansion of the Child Psychiatry Consultation Program, and ensure access to school and community-based mental health services, including peer supports. Our last issue is at the heart of everything that we do at NAMI. We are trying to stomp out the stigma that's associated with mental illness. And there's the definition on your screen right there. It's not just a social issue, it's a policy issue too. And the reason why is because it affects our ability to access jobs, education, mental health services, and other aspects of our communities. So for that reason, policymakers need to be mindful of stigma and its impact when they're writing legislation. And we have this awesome opportunity to educate them by telling them our own personal stories. And so there's some ways that you can help to eliminate stigma. And I just want to share a quick story from one of our original NAMI founders. This mom who used to volunteer in our office recently told me that the first NAMI conference she ever went to back in the 1970s, someone leaned across the table and they asked, "So who in your family has mental illness?" And she was mortified. That very question sent shivers down her spine because she had never talked about it. And now NAMI is a nationwide organization. We have affiliates in every state. We have leaders who are passionate about talking about this issue and treating it like any other illness. So don't worry if you can't remember all the information that you learned here today. The next step is to share your story with your legislators. They are still working. Most of them are remote. If you can't reach someone via phone, please leave a message. Please shoot them an email or write them a physical letter. Don't be upset if you get a return call from staff. Staff are just as important and play just as much of a role in the legislative process as their bosses do. So the important thing is to just have fun, speak from the heart. You're the only expert on you, so you're the only one that truly knows your story of what you need to be successful in recovery. And so with all of these issues, keep asking yourself, how have they impacted your life or the life of your family member? So finally, we just want to share a little bit about how to contact your legislators in case you've never done that before. So the first step is to visit the Wisconsin State Legislature page, which can be found at legis.wi.gov. From there, about on the right-hand side, there is a little search bar. It says Find My Legislators. And what you want to do is type in your home or voting address. After you've typed that in, a photo with all their contact information will pop up on the screen. If you click on that, you can visit their website, read their bio, find out other information about them, such as which committees they serve on and bills they support. And this is so you can kind of get a little bit of rapport with them as well. Maybe you attend the same church. Maybe your kids go to the same school. These are folks in your community. So I encourage you to read their bio before you give them a call. And if you don't have internet access, there is a phone number that you can call, 1-866-VOTE-WIS, and you can find out who represents you that way as well. If you have any questions, I'd love to answer them for you. Please remember to fill out the evaluation form from our website. This data really does help us know what's important to NAMI members and how we can improve our events and our programs in the future. With that, thanks for all you do to help NAMI achieve its mission of improving the quality of life of people affected by mental illness and promoting recovery. Thanks for joining us for Action Online.